Upper right back pain, causes and when to see a doctor. Pain in the upper right back can occur due to muscle strain, spinal fractures, osteoarthritis, and herniated disc. Treatments may involve a combination of home treatments and medical intervention. Pain in the upper back is known as thoracic back pain. It usually occurs between a person's shoulder blades. This video reviews triggers, treatments, and prevention tips for upper right back pain. Causes: thoracic back pain can occur anywhere in a person's upper back between their neck and mid-torso, but it usually develops between their shoulder blades. Several factors can cause this type of back pain. Muscle strain or injury. A person can injure the upper right back muscles when playing sports or lifting objects incorrectly. Straining these muscles can lead to discomfort, which may present as acute pain or a dull ache. Treatment usually involves home remedies such as pain relief medication and rest. Spinal fractures. Fractures of the thoracic spine can result from high energy trauma that may involve a car or motorcycle collision, a fall from a significant height, a sports accident. Treatment for these cases will usually require emergency medical attention. Osteoporosis. Fractures of the thoracic spine can also occur due to osteoporosis. This is a condition where bones become very weak and are more likely to break. According to the American Academy of Orthopedic Surgeons, these spinal injuries, known as vertebral compression fractures, occur around 1.5 million times in the United States each year. Osteoarthritis. This is the most common type of arthritis. It occurs when cartilage in the body, which normally cushions the end of bones to form joints, breaks down or wears away. In the spine, osteoarthritis affects the joints where the vertebra join. Movement of these damaged bones causes further damage and the formation of growths called bone spurs. This can press on nerves, causing upper back pain. Stress. Research from 2017 showed a link between stress and chronic back pain. Stress triggers inflammation in the body, which can increase pain. When a person feels stressed, their body also releases certain hormones which can amplify the sensation of pain. These factors can cause the muscles to become tight, and over time this can cause discomfort. Referred pain. Pain in the upper back can be due to issues elsewhere in the body. This is known as referred pain. For example, the United Kingdom's National Health Service notes that gallstones can cause pain that radiates from the abdomen to the back. The treatment varies depending on the severity and underlying cause. Spinal infection. A person can develop infections of the spine for several reasons. Risk factors for this condition include inadequate nutrition, obesity, immune suppression, diabetes, HIV, cancer. Spinal infections can trigger upper right back pain. Treatments usually involve medical interventions such as antibiotics or antifungals. Herniated disc. A herniated disc is often known as slipped disc. This condition often occurs in the lower back and can also develop in the neck. However, it can also trigger discomfort in the upper right back. Herniated discs usually respond well to home treatment. Upper right back pain when breathing. Sometimes upper back pain can feel worse when a person breathes in deeply. Breathing movements naturally affect the spine as it connects to the rib cage. It is usually not a cause for concern. However, in some cases, it may indicate a more severe issue. For example, it could suggest a problem with the lungs, such as a blood clot or pulmonary embolism. If a person has concerns about their symptoms, they should seek medical advice. Home remedies. In many cases, upper right back pain will resolve with home remedies, which include the below. Medication. Non-steroidal anti-inflammatory drugs such as ibuprofen can help relieve back pain. These are usually available without a prescription. People can take them orally as a tablet or apply them topically to the affected area as a cream, gel, patch or spray. Hot and cold. Using a hot water bottle or lying in a hot bath can help alleviate pain in the upper back. Ice packs can also help ease back pain, but a person should not apply them directly to the skin. Instead, they should wrap ice packs in a towel or cloth before applying to the affected area. Rest. Although rest can help with upper back discomfort, a person should limit being sedentary for too long. The National Health Services advises that people with back pain stay active. Stretches and exercises. Various stretches and exercises can help prevent or alleviate pain in the upper right back. Medical professionals often recommend yoga to keep the back healthy and prevent discomfort. It could also stop pain from returning. Diagnosis. Muscle strain is often the cause of pain in the upper right back, but sometimes there might be a more serious reason. A healthcare professional will ask a person about any recent injuries to the back, such as a sports-related incident or a car accident. They will also ask about a person's medical history and the pain itself to determine the cause. They may refer people for further tests. Prevention. While a person cannot always prevent upper back pain, they can practice techniques to reduce the risk of developing it. They include lifting objects safely and correctly, taking regular breaks from sitting for long periods and from doing repetitive tasks, making sure to get up and walk about regularly, practicing good posture when sitting or standing, when playing sport, learning and practicing correct technique to avoid injury. Ceasing any activity that causes back pain. When to see a doctor. A person should seek medical attention if they experience back pain due to injury or an accident. They should also speak with a doctor if their upper right back pain does not go away after a week. A person should seek immediate medical attention if the back pain accompanies other worrying symptoms, including muscle weakness, bladder issues, tingling or numbness.